So, Mahmood, if you want to introduce Tina. Okay, probably Mahmood might be busy. So first of all, faculty, this is my honor that we have Tina Coleman. She is one of our fellows and resident who trained at UW, and now she is a faculty in Florida. And she was kind enough to share her expertise with us in this grand round format on how do we provide a feedback. And this is indeed a challenging topic, despite our best efforts. Sometime using the right strategy and words can make all the difference. So Tina is here to guide us through that process. So Tina, thank you so much for doing this.
Thank you so much, Dr. Sahani, for inviting me. I'm really excited to have this conversation. It's one that is not often welcome in the workplace, but it's really gratifying when we have that opportunity. So without much ado, I'm going to go ahead and share my screen and get started with the presentation. Can everyone see my screen?
Yes.
Yes, perfect. All right, so I wanted to title this talk, Providing Culturally Competent Feedback. And it's an interesting conversation. But first, before we get into it, I wanted to take a minute to define the types of feedback and then identifying an ideal feedback process that would work for faculty and trainee relationships. And in that vein, exploring the 4 critical components of what we consider an ideal feedback process. And then finally, examine the process of code switching, which you may or may not be familiar with, but it will be very interesting because this will give us more insight into how URMs and non-URMs interact at work and what they're bringing to the workplace. So let's start by talking about the types of feedback. So linear feedback, basically it's one-sided, originating from faculty to trainees or vice versa. There's not a lot of interaction. You say what you say, you move on. There's no opportunity to discuss, look for ways to improve. It's just you're this and then you move on. Interactional feedback, which is what we would hope to have, is a continuous and ongoing process between faculty and trainees where you have conversations. They tell you what you're doing well, what you could improve on, and then you give context as to why you may have been performing that way, and then you discuss strategies that you both think will be helpful in helping you improve moving forward. Corrective feedback is one of the more difficult aspects of feedback because it identifies specific things that you need to improve on. And let's be honest, having a tough conversation is difficult, especially in this socioeconomic context or climate. So most people at least exhibit some degree of angst in whenever they have to give someone corrective feedback, specifically in a verbal format. So we have to acknowledge that it's uncomfortable for everyone involved, and we have to look for or explore ways in which to allow both parties or everyone or stakeholders to engage in this process and be able to leave the process feeling like they've been heard and having actual tangible things that they can work on. So we know that providing corrective feedback is especially difficult for people of different backgrounds or cultural beliefs or biases or stereotypes. So it's something that we should be aware of. So in that vein, we also have to acknowledge that most people fear providing feedbacks to people of different cultural backgrounds because let's be honest, no one wants to be a hashtag. That's just the bottom line. And so, but we have to do the difficult work of providing or having these uncomfortable conversations if we are, and as we are all vested in training trainees to be the best versions of themselves and to be ready for work or ready for the profession. But to leave training with their dignity intact and not leave beaten down and just worn out by the process, which is something that's been expressed by trainees and URM specifically. It's well documented in the research and from personal experiences as well. So ideally, feedback should be a conversation, and the one that is only completed once the feedback loop is closed. So you can communicate what you want to someone, but if they are not perceiving or they don't understand what you're trying to impart, the knowledge you're trying to impart upon them, then there's a breakdown in the process. So in my view, there are 4 things that need to happen for a complete feedback process. The feedback, number 1, has to be accurate. It has to be timely. It has to be actionable, and you should give an opportunity for the recipient of the feedback to close the loop. So in exploring accuracy, you have to make sure that the right feedback is assigned to the correct residents. Although this is rare, there have been instances where residents have received feedback that doesn't pertain to them, or they've been mistaken for R5s and considered lacklusters. And we understand that it's a huge, I mean, it's a huge class, it's a huge challenge, and keeping track of everyone is difficult. But if you're going to provide written feedback specifically, it'll be nice to make sure that you're giving accurate feedback to the correct resident. So the feedback should also reflect the entire experience. So a bad day on surface should not eradicate 19 good days, right? Because it's 5 days every week, right? So if you have a bad afternoon or one bad experience, hopefully the feedback process should be all encompassing, so it doesn't perpetuate this idea that physicians have to be perfect. There's no room for mistakes. There's no room for growth. You either come in fully formed, no mistakes, perfect attendance, or you're subpar. So the feedback process should reflect the entire experience and not just harbor upon shortcomings or perceived shortcomings in that sense. So a large part of providing accurate feedback is providing congruent feedback. So a lot of the challenges is like the verbal feedback you receive is very contradictory to the written feedback you get at the end of the rotation. And that just erodes and corrodes the trust in the process, and it devalues and violates really the trust of the feedback process, which is really a sacred thing, because that's what we use to improve ourselves. That's how we get to be better doctors and to become more competent in the field. But if I cannot trust that what you're telling me verbally is correct, that there's a breakdown in the system. The next aspect we're going to explore is timeliness. So providing timely feedback is important, because when feedback is delayed after the end of an episode of supervision, so if I get feedback 4 weeks, 8 weeks after the rotation is over, there's no way for me to redeem or correct or improve upon behaviors that are brought upon. And sometimes that the way that the trainees may interpret that is like, number one, they're not worth the time, they're not worth the effort. It's like, if you thought I was struggling throughout this whole 4-week process, why didn't anyone say anything? Either they particularly don't care if I improve or not, or they don't think I can improve. Right. And so that's then they get into their heads, and that again just further leads to eroding the process. Now, there's some we understand that that may not always be the truth from the perspective of the attendants. They may just be busy, they may have gotten behind. But again, if you're going to provide feedback, timeliness of feedback and giving people a chance to improve is critical and is paramount for people to get the most out of this process. So we've harbored upon this, and specifically corrective feedback. So when you're telling someone they have things they need to improve on, it's important to have that conversation with them in a moment when they can fix it. We know that the longer it takes to receive feedback, the less accurate it tends to be. You've moved on to the next rotation. It's hard to, improve, especially if you're on rotations like a procedure rotation, and your next rotation is nukes, where you may not be doing a lot of procedures. So it's hard to then use that feedback 9 months, 12 months later, and not have an immediate chance to improve. So all of this is to say, corrective feedback is an opportunity to have a conversation, to come to the table and say, this is what we're perceiving, this is how we think you can improve. And then the resident gets a chance to say, I agree, this, or give you context, for example, and just say, I've been a resident myself, or we all have, right? And a lot of people deal with miscarriages, people deal with failed marriages, people deal with grief, people deal with loss. And unfortunately, we cannot all bat 100 every single day, because we have real life behind. So sometimes just having context may not change the outcome, but it provides an opportunity to have that conversation, and it creates and fosters trust between the trainee and the faculty member. Thirdly, feedback should be actionable. The resident should walk away from the experience knowing what they did wrong and having strong suggestions on how they can improve. And so no one should be confused about what did I do wrong. And sometimes feedback can be generic. It could just be forgot to look up histories on one case. It's just something like that. The bottom line is you should give people actionable feedback that they can use, and it should always remain objective, not personality attacks. So telling someone they don't fit in, telling someone they were different than the rest of the crowd, and it's hard to change your personality. And so as much as we can, we should keep objective feedback, although sometimes you don't have an option. You have to address disruptive behavior. So specifically, URMs have struggled with this in talking to people around the country within the program, other programs, other specialties, is the idea that you don't fit in. So you don't seem engaged at work. You don't seem invested. You seem checked out. You're not as jovial as everyone else. But it is often demoralizing because that decision to not engage is a coping mechanism, which we're going to explore in the second part of our talk. And so this can, again, just lead to eroding the confidence. Anytime there's a breakdown in this process, it just erodes the confidence, and the intention of the feedback is not fully actualized. So URMs already know they don't fit in. They, like I mentioned, they have to make a conscious decision, and this is a process of called code switching, which is what we're gonna focus the second part of our talk on. Some of you may or may not be familiar with the process. But lastly, in the close the loop process, right? So ensure that the intended message has been understood by the recipient. We know communication is not complete until you ensure that the person you're talking to has understood what it is you're trying to convey to them. And then it also gives the evaluator to get feedback on the feedback process, which is something that sometimes faculty may struggle with. It's like, how do we know if we're doing a good job if if the residents are evaluating us months after their rotation or whatever they get triggered by the MedHub system or whatever. So again, see this more as a conversation with two groups of stakeholders, and with the vested interest being in training the resident to the best possible way that it could be. So, and the closing the loop also gives us an opportunity to clear up any misunderstandings. And it's sometimes bad feedback or corrective feedback or perceived deficiencies or lackluster performances are just misunderstandings because of cultural differences. And so this is an opportunity to allow for growth enrichment and to really foster the diversity of the community at UW Radiology or any other program. So let's talk about code switching. So code switching, which some people may or may not know about, is this excellent article in the Harvard Business Review, which talks about the cost of code switching. And before I go any further, I want to take a second to define it. So code switching is adjusting your style of speech, your appearance, your behavior, your expression in a way that would optimize the comfort of other people in your environment in exchange for fair treatment, quality service, and employment opportunities. So it's basically presenting or bringing a representation of yourself to work to make other people around you comfortable, so you can be viewed as, so you can maximize your opportunities for advancement, progress, thriving, or just being treated fairly at work. And this is something that's mostly been described in African American communities and URMs. That's what most of the research shows, but you can see how it can be applied to multiple other groups. And it often occurs in spaces where there's a negative stereotype, specifically of Black people, which run counter to what's considered appropriate behavior and norms for that specific environment. And I'm going to go through specific instances in the report, because I think it gives us good examples of what is considered abnormal or a deviation from normal behavior, and how that can negatively impact a resident or a trainee's experience in a program. So in case we were not reminded, here's the data from it's a JCR article, and it basically looks at the representation of URMs among all GME trainees and among the radiologic professions. So as much as we love to say that we're diverse, the numbers have essentially remained between, at least from 2000 to 2014, is basically a flat line, at least in radiology. Radiology oncology kind of had a dip. And as far as all GME programs, there's been a slight increase, but by a few percentages. So just to URMs are already aware that this is not a typical environment for them. So they have to they're already making adjustments and bringing versions of themselves to work. So code switching, while can be useful and critical for professional advancement, it also comes at a great psychological cost to the trainee or to the employee. So true inclusion requires understanding that a segment of your employees, a group of your workforce, truly believe that they cannot be themselves at work. And that's an issue. And no one's impervious to code switching. And this is supposed to be a video of President Obama. I wish that they would play, but demonstrating how he, you may or may not remember this, when he was greeting a bunch of NBA trainees, and everyone remarked at how differently he greeted Kevin Durant. This made the news at one point, and the idea was, if he's not impervious to code switching, like what hope then do we have? And so that was a big issue for that. I don't know why it's not playing, but anyway. So going back to the idea of code switching, downplaying, URMs sometimes have to downplay their membership in a stigmatized racial group just to help increase their perception of professionalism. So they go out of their way to show shared interest with members of the dominant group, with the hope of being accepted or liked or given an opportunity to thrive, or just being treated as neutral. And this is an internal conversation, right? This may not be what the dominant group is portraying, but that's what the perception is. So the disadvantages of code switching then is it alienates you from your own culture, and being constantly on the lookout to avoid stereotypes. It's hard work. It's like a full-time job, and it can deplete actual cognitive resources that will hinder your performance at that work. If you're constantly worried about the way you're being perceived and the way you're being viewed in an environment, it can definitely negatively impact the way you act. So some people have expressed feigning commonality with coworkers to reduce authentic self-expression, but this can contribute to burnout. So I've had residents who, specifically in the Seattle area, who've told me, if you want to thrive, pretend you love dogs, pretend you love hiking, do everything well, just bring a version of yourself to work. And these are actual conversations by past graduates, both in radiology and outside of radiology. It's like, you have to find a way to fit in, even if that means dishonesty and falsehood. At the end of the day, it's like, do you want to finish, or do you want to bring your authentic self to work, when that authentic version of yourself may be considered disruptive, unwelcome, and generally problematic for the dominant group? So let's explore reasons why people may choose to code switch. Leadership aspiration, reviewing the literature, Black employees with higher career aspirations for leadership and promotion have reported actively avoiding to conform to Black stereotypes just so they can have a chance. Like those that just then have no interest in leadership tend to be like, I am my full self at work, and that it is what it is. So respondents specifically in a survey said, I go out of my way to make sure I don't appear lazy because I know the stereotypes of the way Black people are considered. Another stereotype is the angry Black woman stereotype. If you are bothered by something and you want to voice disagreement, a lot of trainees, URM, specific Black women, go out of their way to be extremely courteous, even when they're offended, even when they're struggling with something. They don't feel comfortable voicing disagreement in order to avoid this stereotype of the angry Black woman. And there's this concept of fitting beyond your race. So some Black employees perceive that they fit into their organization regardless of race. And they also, however, they also reported downplaying their race and promoting shared interests with the dominant group members. Those who fell into this category, although they did well or they perceived more career success, they were more likely to burn out in the long run, because let's be honest, it's exhausting to constantly try to fit in and represent a version of yourself that is not true. There's another concept of hypervigilance. So the high levels of vigilant behavior when you feel like your true self is an aberration from the norm, or it sticks out from the group. There's this idea where you're always preparing, you're always vigilant for the next thing, the next instance, the next incident. And so that's something that they URM sometimes have to deal with. So here's an example from a survey. Due to the questions asked by my coworkers, it is clear that my presence is viewed as a sneak peek into Black culture. So I find myself constantly trying to be aware of my mannerisms to ensure that I do not portray myself or the people I represent in the negative light. So there's this concept of being the one Black, or the few URMs, right? You have to make sure that you are the best version of yourself. You make no mistakes, so whoever comes behind you has a shot at getting in. And it's not a process that's unique to URMs, but it's experienced by them in a unique way. Because even personally in my mind, it's like, what version of Tina can I really bring to what I struggled with this my first couple of years in training? Can I truly be myself at work? Like, or would that then negatively impact other people's chances of getting in? And that was a battle that I lost my R3 year. I couldn't keep it up. Anyway, so being a version of yourself, right? So giving a sneak peek into Black culture. Here's another example. A 22-year-old Black woman said, it's always easier to anticipate the complaints, the jokes, the negative comments about your hair, wearing natural hair, makeup, talking, voicing your opinions, and just, if you expect it, then you can just adapt to it and ignore it just to keep the peace at the workplace. Even if you're being offended, you don't feel comfortable enough to voice disagreement. So we found out that the racial composition of a workplace can influence the extent to which Black employees or URMs decide to code switch, right? And so there are two extremes, right? The idea of colorblind ideology, where everyone's treated the same, where you don't acknowledge differences, you don't acknowledge diversity, you don't see color, you're colorblind, everyone's equal. This is, and versus saying that, no, everyone's not equal. Everyone brings unique challenges, unique backgrounds, unique stories to the workplace, and that can affect the way that they interact with us, we interact with them, and the way that they perceive the power structure or perceive the makeup of the organization and their decision on how to navigate through that. So if a failure to acknowledge the differences reduces the ability to recognize discrimination. If you don't, and if you treat everyone the same and you're colorblind, then you will always be blind to discrimination, because the knee-jerk reaction is to explain, if someone says, I feel like I'm being treated different, and the answer is, well, that's no, actually it's not racism, it's just unconscious bias. It's harder for that person to step up a second time and say, this is wrong, or this could be improved upon, or how could we ameliorate this? So, again, if every organization has to make that decision about which way they want to go, you can decide to embrace the colorblind ideology versus embracing a truly multicultural ideology. So here are some examples about perception of code switching from the dominant group. So you may wonder, you may say, okay, code switching, never heard of this, it's not a real thing. But here's some data actually where they interviewed some white participants and looked at the behaviors around code switching. And so in general, they perceived behaviors as more professional. For example, Black employees who adjusted their hairstyles to fit European standards were viewed as more professional. Why wear your natural hair is considered disruptive, or wearing dreads or wearing braids versus a perm or weave or long straight hair or versions of that. And so so some people have been suggested that minorities or URMs should use their middle names, or suggested that names like Lakeisha. There's some examples in here later on in the talk, but nappy hair is just unprofessional for the workplace, some of the respondents thought. And so looking and behaving professionally is very necessary for working in a place. The name Lakeisha sounds Black, and some may even think ghetto. So they said using a middle name like Renee is considered more conservative and more acceptable. So that they suggested that that's what the minority should use at work, just because it made them more comfortable. And so the dilemma then that URMs face is like, to what degree do you suppress your cultural identity for the sake of career advancement? Or do you sacrifice potentially thriving in a group for the sake of bringing your whole self to work? And so this is a unique challenge that URMs and sometimes women face in coming into the workplace and having to have that internal struggle to say, can I be my full self, or is that too much in this space? Or would that impact the opportunities for people who come behind me? So the dilemma then is not just psychological risk, but it also affects the organizations, right? Because you miss out on the distinct perspective and contributions from a whole group of people who are just uncomfortable bringing the full selves to work. And that's not a process that's unique to URMs, but using it to explain that process. So how can we address this issue? So there's several ways we can work on it. So the organization itself can examine how their workplace culture may create pressure for minorities to code switch, right? And what are the things that are in place that that may cause people to feel like they cannot be themselves at work? So another thing you can do is tackle representation at all levels, right? From the bottom of the food chain to the top. Sometimes just having anyone who looks like you will make a difference. So I remember specifically fellows from last year class saying, I took a job because the secretary was Black, compared to everywhere else, or just because having someone else and having her perspective, and she's been there for 20 years, for 30 years. So why they didn't have an attending of that race? They didn't have an attending of that race. The fact that you have someone else that even works, not even at the same level, makes a huge difference. So representation doesn't always start at the top. Any representation makes a big difference. So in the same vein, or likewise, right, a lack of representation makes even the slightest cultural difference much, much, much more noticeable. And so you basically are sticking out like a sore thumb, and URMs can sometimes end up feeling like a prop or a tool, or just, that it's a very uncomfortable feeling, to say the least. So as from the organization level, this is something that we talked about in the last talk, making a distinction between diversity and inclusion. So we know that all efforts to solely increase diversity are bound to fail, because the environment, the inclusivity of the environment, is what determines the cultural enrichment. It's what determines how people feel in that program and their likelihood that they're going to stay and continue to grow there. So valuing diversity is not enough to reduce discrimination. You have to also address issues outside of the companies that affect the Black employees' work experiences. And that's an example of what this talk is, right? Is to say, how are the different cultural backgrounds that we bring in? How does it affect the way we interact at work, the way we work, the way we fail, the way we struggle, and the way we voice disagreement? So that's an important issue, and this is valuable. Again, just having a conversation allows us to begin the difficult work of addressing this issue. So inviting all of these conversations also makes the minority employee feel like their individual contributions value more than just the bottom line. It's not just how much can you produce. People actually care about your growth, or the environment, the milieu in which you're working. So it really makes a big difference. And that can go a long way in recruitment and retention as well. So in creating policies and rules that promote differences and meritocracy. So you want to hire people who are qualified to do the work, right? And you want to be fair in the process in which you do that. However, we know that traditional recruitment methods strategically exclude certain groups. So if you're going to hire and to try to actively change, you have to address the inherent bias in the recruitment process, and then examine those biases and say, how can we make a difference? So leaders and coworkers, what can your co-workers, co-residents, co-workers, what can you do to embrace? So the one thing you can do is embrace inclusiveness as a daily practice. Be curious and learn about cultural differences. Intentionally invite URMs or other minorities, all right, to into your network and actively listen to your input. So if you invite someone, you ask them their perspective, and their perspective is different than yours, don't shame them. Don't try to explain it. Don't try to downplay it. Don't try to devalue it. Acknowledge that it's different than what you experience, and then allow an organic conversation to emanate from that. And another important aspect is self-reflection, right? Is there an identity? You yourself have to look within you if you're part of the dominant group. Is there an identity within you that you may be hiding or downplaying in the workspace? By bringing more of yourself to work, you somehow give other people permission to do so. And there are a lot of examples where that's worked very well, you know, and work, even in my own experience at the University of Washington, there are just some attendants that are so authentic about who they are that I felt like they gave me permission to just be different or to voice a different opinion. And that's always refreshing and valuable to hear. So recognizing that your own differences can reveal which parts of you are not welcome at work, and then it can help you understand what the professional dilemma is for URMs, or what the dilemma is that they face in deciding whether or not they should bring their full selves to work. So check your biases, right? And you may, so people specifically have voiced opinions about preferring their coworkers with straight hair versus a natural hairstyle. I mean, California just passed a law this year or last year saying it was illegal to tell people they couldn't wear their natural hair at work, which is insane because it's 2020, but that's where we're at. And so, being asked to change your hairstyle or to accommodate or to go by different name or a shortened version of your name, or, you know, whatever else, right? So engaging and looking at your own biases, it's good because it forces you to be curious rather than asking URMs or Blacks to explain their differences to you and adjust those differences accordingly to suit the status quo. So what can a URM do, right? If you're going to code switch, you can be strategic in your code switching. You cannot be a fake version of yourself 24/7. It's worn out. People, if you look at the research suggests that people live burnt out, depression is real. People have expressed thoughts of suicidal thoughts and ideations, right? And it's just a mental toll to be in code switch mode all the time. And it's pervasive in every single aspect of society, right? It's Michelle Obama addressed it, the idea of being 8 years and not being able to make a mistake at all, right? Because you're constantly being judged against what the dominant group thinks, right? So it's hard. If you can be strategic in doing that, you can find same race mentoring. If you cannot do that within radiology, look outside of other specialties. Look in surgery, look in family med, wherever else. If you can find, or remote mentoring, right? Find attendants from other backgrounds. That's something that you can actively do. And then if there's a 3-step that the article suggests, that if you're going to suggest code switching, assess your environment, assess your values, and assess your long-term goals, because ultimately you do not want to leave this process being broken and beaten to the point where you barely can recognize yourself. So you have to be honest about what your ambitions are, what you're willing to compromise, and what your long-term goals are. Unfortunately, it's not fair, but that's our reality. So make a distinction between assimilation and professionalism. And so you should always remain professional, but you should not, it's I would caution you against assimilating to the point where you can barely recognize yourself. So, and then understand your role in the workplace, right? It's not your job to make your coworkers comfortable with you. It's your job to be professional, perform to the best of your abilities, be courteous, treat your patients to well with respect, and then and allow everyone else to grow from that experience. And also understand that you're allowed to make mistakes. This is a common theme in looking at the research. URMs, for some reason, felt like they should be held to the standard of perfection that was just almost unrealistic. It was the idea that if I do make a mistake, I fear that it will be taken, the punishment will be exaggerated or whatever else. Not saying that this is actually true, but that's what the internal conversation is. And so the role of this talk again is to give you a little bit of a window as to a little bit an idea of what the URM goes through, that internal head battle and the conversations that they may sometimes have with themselves. So I'll leave with this, bro, right? The gateway to cultural competence is cultural humility. Just the idea that just because it's your culture doesn't make it, like, just because it's a dominant culture doesn't make it the correct way. There may be a different way, there may be a different experience. And cultural humility, again, is that idea of self-reflection, self-critiquing, where you learn about other people's cultures and you examine your own beliefs, your own biases, your own cultural identity in a way, with the aim being to provide or interact with patients, trainees, wherever else, in the most culturally enriching manner, where people can leave the conversation. Again, we're talking about feedback. Everyone should leave that conversation with their dignity intact. No one should be broken down or like devalued or just beat down by the process. And although, and if there's a disconnect in what the perceived feedback is, there should be a process through which people can address these differences without it being in a punitive manner, without it saying, oh, I'm confused by this feedback. I thought I was doing well. I was told I was doing well. There should be a well-established process or procedure by organizations that allow people to address perceived differences in feedback. Here are my references, and I'm open to any questions.
Thank you so much, Berthina, for the presentation. I just had a couple quick questions. One is, as you were going through your presentation, I was thinking about things we could do, and one I thought of is, in terms of, as you mentioned, the effort for code switching and hiding your cultural and maybe behavioral approaches. What about having events, events to celebrate, underrepresented minority holidays, things like, I think until this year, 90% have heard of Juneteenth, but celebrating things like Juneteenth or, other potential holidays we could consider, or having events to celebrate, cultural aspects, dress, other sorts of things that we could celebrate as an institution. I think historically, I think a lot of people like to have kind of whitewashed holiday parties, and certainly maybe not pushing religious, components on people, but maybe include some cultural aspects to it, might be of value.
I agree, Mahmood. Any opportunity where you allow people to engage outside of work and just allow you to show them, or for them to show you another version of themselves, is very much welcome. I know NERF does some of this work already within the UW system. So maybe actively engaging with them and then maybe having things within the department again, it's only going to help. Yeah, Juneteenth is a big deal. So I remember trying to take that as a personal holiday, and they were like, "What? Get out of here!" It's like, so it was like, but anything helps. Having these conversations, having events, again, are useful in just exposing people to different cultures.
That's a great comment, Tina, and this was a fascinating talk. A lot of great suggestions. Anyone has a question for Tina?
Yes, this is Gautam. Hi, Berthina.
Hey.
So I just have a question. You said that there were some attendings who brought their authentic selves to work, and that made people more comfortable then, made residents comfortable to bring their authentic selves. Is there any example you could give without necessarily sharing private information? Because I'm a little bit curious about how people are doing that.
Well, let me see. How can I bring this? Well, I can share an attendant's name, and then you could have a conversation with them without, because I don't feel. But I specifically remember having conversations with Jason Wright, and I left feeling heard, feeling viewed, feeling okay to be different. And it was, for me, that was one of the first times in the program, and it was in my children's rotation. And it was just an amazing experience. And it wasn't anything that he did or particularly said to me, but the culture that he cultivated in the reading room felt welcoming, felt inviting. It allowed me room to fail. And it was just, I was just a resident. And that was an amazing experience. So you could talk to Jason a little bit more about that. I don't know how to divulge things without being specific.
Thank you.
As people are thinking about, oh, sorry, go ahead.
Sorry to interrupt. So another thing I was thinking about, and this is something that I know the EDI group at Seattle Children's was doing, but they were doing a lot of lunch and learns, right? Where they were bringing in specific topics and having these open kind of town hall discussions about various EDI topics. And I certainly participated in a couple of them for Seattle Children's, but I think maybe implementing something like that across our department, across other various aspects of our department might be interesting.
That would be amazing. I wish I'd known about them. I think that would be awesome if we could have like luncheons and conversations around this topic. Do you know if it was led by a particular attending or a group, or did they bring outside speakers? How was it?
It wasn't specific to radiology. It was specific to the institution as a whole. And so they would have specific topics and they'd go to different areas. So for example, the ones I was involved with were more focused on research and diversity in research and how to engage underrepresented minorities to be part of research studies and the need for, minority representation. So, a variety of topics that they would end up addressing in throughout the institution.
Nice.
One of the points I want to raise, Tina, and you brought up in your presentation as well, knowledge is powerful, and a lot of stereotypes which are propagated is, I think, out of ignorance. And which Mahmood also mentioned, if we have opportunities to have conversations on diverse topics, whether these are lunch and learn events or just a town hall type of events, picking a topic on a regular basis, which not only empowers us with more knowledge, we gain cultural sensitivities, and we all learn, as you mentioned in your talk, it's a journey. There are a lot of things you have to learn over time. So I feel, what is your view on that?
I think you're right. It's a conversation that should definitely happen. And having guided talks or directed talks, like Mahmood suggested, can only help. And we also just to highlight a perspective, it's not just we're not asking the dominant group to adjust to the URMs and cater to them. The URMs themselves have to make adjustments, because for me, so my cultural identity, I'm an African woman, but once I'm in America, I'm perceived as an African American. So I had to engage. There were just these expectations that I somehow had to know, and it was only through like conversation. So any opportunity to bring those conversations to the forefront, because a lot of times perceptions of what you think people are thinking about you is actually not the truth. And the only way to know that is to confront this, not confronted in a confrontational manner, but it's to address them in a not threatening, comfortable environment. And it was just, but when I was able, or when I made a decision to just be myself at work, everything was fine. It was just a mental prison I was in. It was like, you're yourself, you know, it's, you get good reviews, you get bad reviews, you know, it is what it is. You improve when you can. But for me, the cost of being in constant code switch mode, I didn't even know what that was, but it was like an expectation. My surgery, I struggled a lot because I was like, I'm supposed to just take this. I remember talking to Alison Tilla quite a bit about this. She was like, Tina, I think so. You know, I was just like, this makes no sense, you know, and having to make that adjustment and just say, okay, so there's a totem pole. This is where I am. I'm supposed to readjust to this level or portray myself a certain way. So I think anytime you have those conversations, they're valuable because there's no code switch in school, you know. It's just like you're just redirected. It's like Pavlov's law. You just keep getting negative feedback until you're like, oh, okay, so I can't be myself. I should just be this person. Got it.
Thank you.
Hey, Tina, this is Jerry Jarvik. You know, first I want to say thank you so much for talking about this. You did a great job. You know, I think not only summarizing, but making accessible a lot of concepts that maybe some of us don't think about so very much. My question to you is, you know, in a department, and you brought this up, the importance of having mentors who are of the same race and same cultural background. And, you know, in our department, we don't really offer that on the faculty level. And so are there things that we could do as a department as far as setting up infrastructure or thinking proactively about how to make those connections maybe outside the department for trainees since it's not available inside the department?
Absolutely. So a lot of that work is currently being undertaken by the massive EDI effort that Dr. Sahani is leading, and it's to understand that the radiology community itself, it's relatively small. And so a lot of trainees, for example, want to, like I've spoken to at least 5 people that graduated. I'm like, would you be willing to mentor residents? They're like, of course, but in what capacity? Is there something set up? So I think that setting up a system where you can engage your best, most valuable assets are your current residents and your past residents. Mm-hmm. If everyone that left just stayed back or stayed available to mentor someone else, it would alleviate a lot of the challenges. And then, for example, when I graduated, I also, a few of us actually reached out to specifically Howard and Mehari, just saying that if someone needs mentorship in the field of radiology, we want to make ourselves available. So people are doing the work, but in an informal capacity. So what can the organization do? Number one, acknowledge that we need representation at all levels, because it makes a difference at all levels consistently. Secondly, identify URMs within the UW system who are not a radiologist, and then pair them with trainees to match. I know Estelle Williams does an amazing job in surgery, and she runs the Doctor for a Day program, which is really, really amazing. Sometimes having that perspective is valuable and needed as well. So while you may not be able to find people locally, encourage residents and provide resources for them to reach out outside of the department nationwide, and then go to conferences, right? SNMA has been in existence for decades, and people can go every year, right? You can make connections at this place. And SMA is the minority, association for medical students. So there are lots of opportunities there. It's just a matter of deciding to do the work, which Dr. Sani has gladly started already undertaking. And I think that we're just in the process of getting there.
Berthina, I wanted to ask another question. We had some discussion about, code switching and ways to address those differences and maybe perceptions related to those differences that hopefully we could be able to change. But the other component you mentioned is the stereotypes and the false narratives associated with that. And it's certainly different than implicit bias to a certain degree. I think there's some overlap. But how do you think we address those explicit stereotypes that may exist in some people's minds?
It's hard because you're asking people to address the dirty laundry in public when they're like, wait, I don't have dirty laundry. I'm neutral. It's you have to define the cultural identity of the organization. You're either going to be a colorblind society, you know what I mean? Or you're going to be a culture that's going to address, or an organization that's going to address these issues. If you create an opportunity for these conversations to happen, people will be confronted organically by their own biases, right? And URMs also, we also come into this conversation with biases or preconceived notions. And so I think that creating an opportunity for the conversations to happen and continually providing education. Like most people don't even know what code switching is. That's just a small part of what people have to do to accommodate. Just even knowing what that is, you'll be able to somehow perceive. And it's funny, after like 5, I wasn't sure what it was. And I was like, oh my God, I'm doing it now. I'm literally code switching. And I wish you guys should, when you get a chance, watch the video of Barack Obama, because it's so instinctive, it's so quick, and you slip in and out of it without even realizing. And sometimes those slip ups are, different, but it's really creating an opportunities for these conversations to happen. It's a huge, huge step, which most organizations, frankly, don't care about, because again, doesn't, in the short term, short-sighted term, right, doesn't really affect their bottom line that much. So I think that just, if you keep having these conversations, that's half the battle right there, because you're forcing people to confront their biases from both ends, from both spectrums, and then you're creating ways for conversations to happen around these topics, and directed or otherwise.
Hi, Tina.
Hi.
Hi, my name's Ann Wilson. I'm a research coordinator in radiology, and I know this is a broad question, but I really appreciate your presentation. What is one thing you would say to any of us, even though we try not to, some of us try not to be biased, but we are. What's one thing you could say to us that we would, how can we help not be, I guess? Like if I approached you, I mean, I'm not saying that it's a simple thing, but what's one thing you would be interested in how to be addressed? Or I know this is personal, but.
Yeah, I think the best thing you could give one of the most fundamental gifts you could give any human is to be seen, and to be seen in their real self, not a representation of their self, right? And so it's hard to have that in one interaction, right? Especially if for example, if I engaged in you, it'd probably be via email, right? Based on the work you do. And it's a hard question to answer, because you have to first see people before you can address the differences. Because if I don't trust you, right, all of the conversations seem forced, they seem coerced, they seem gimmicky, they seem, it's funny because the conversation, before we did the presentation last spring, it was so hard to get people to come to the table, because they were like, this is going to end up biting me in the back. Good things don't happen to people like us who speak up, right? And the best way to combat that evidence is saying that you did speak up and nothing bad happened. Things actually got better. That's the best thing. For me, the reason why I'm so invested, why I'm so involved, because the best gift you can give is to see people for who they really are. And that's in my 6 years of training at UW, that's the most proudest I've been. It's been in the last 6 months, is to be able to speak up. And it's not that I didn't speak up. All the things I said in that presentation, I've always said. It was just like, oh, okay, go out of the living room. But the idea of just saying, to see people And then the best evidence is saying that, okay, I said it and nothing bad happened. It actually got better. That's the opportunity, I think, and not judging when people speak up or when people don't react in a way that you expect, because again, you don't know the emotional baggage they're carrying.
Thank you.
Bertina, in that regard, what we're doing here is that we're all on a steep learning curve, and I'm learning biases and I'm learning sensitivity. But I find that my best learning comes from specifics. And and that was what was wonderful about last spring, is that specific examples that are depersonalized. This is what someone said to me. This is how it felt. This was the impact it had on me. Or this happened to me. This is how it felt, etc. I learn a lot from that. And I'm just wondering if you would comment on the willingness to talk about depersonalized specifics.
I share your, that's the way I learn best. It's like if you can share actual examples in a way that's not shaming, demeaning, or putting people down, and just use it for what they are, learning experiences. There are a plethora of those, right? There's a lot of examples. The problem is having people being willing to step up and come forward. And that comes from trust. You cannot expect someone that's been, I'm 36 years old, I've been in this country for 18 years. People were born into this, and you're conditioned to believe that good things don't happen. So it's hard to go against all of that process, right? And all of that training and really survival instincts. You're telling me to now, everything that's helped me survive, I'm supposed to just lay down and trust that this is gonna work. You know what I mean? So it's like that. I think that the way to create more of those opportunities, more of those aspects, is to create more trust in your community. And the way to create more trust is to give space for these conversations to keep happening. Because the truth, it took a lot for people to come forward and just give actual examples. And even being Dr. Sahani, he didn't have to let us say those examples, right? He could have edited it. He could have, you know, I think that if you create more trust between the two communities, that's then you get people's their real feelings and their real thoughts. And so that, in my experience, I agree that depersonalized examples are great, but people are very wary of, just to get those examples, it was like 80 hours worth of work of just saying, are you going to present this in a way that does not target me?
Yeah, that's a great point, Tina. And I think creating a non-punitive culture, which builds the trust, but also having these opportunities on regular basis, desensitizes ourselves from being persecuted or any unintended consequences of. And I think we get comfortable not only speaking up about topics that we find typically challenging, but also we learn to respect each other. So, and this is a process, and we are committed to take this journey and be fully embrace it, all aspects of it.
I agree.
If there are any last minute question for Tina? If not, Tina, thank you so much for that. Was a fascinating discussion, and giving your time and also your commitment for being engaged in this process means a lot to the department and to all of us.
Thank you for having me.
Thanks.